Filariasis is commonly known as elephantiasis. It's a neglected tropical disease. Infection occurs when filarial parasites are transmitted to humans through mosquitoes. Infection is usually acquired in childhood, causing hidden damage to the lymphatic system. The painful and profoundly disfiguring visible manifestations of the disease, lymphedema, elephantiasis, and scrotal swelling, occurs later in life and lead to permanent disability. These patients are not only physically disabled, but suffer mental, social, and financial losses, contributing to stigma and poverty. Cause and transmission. Lymphatic filariasis is caused by the infection with parasites classified as nematodes, roundworms, of the family Filariasis. There are 3 types of these thread-like filarial worms. Wucheria bancrofti, which is the one responsible for 90% of the cases. Adult worms lodge in the lymphatic system and disrupt the immune system. The worms can live for an average of 6 to 8 years and during their lifetime produce millions of microfilariae that circulate in the blood. Lymphatic filariasis is transmitted by different types of mosquitoes. For example, the Culex mosquito, widespread across the urban and semi-urban areas. Anopheles, mainly found in the rural areas, and Aedes, mainly found in endemic islands and the Pacific. Symptoms. Lymphatic filariasis infection involves asymptomatic, acute, and chronic conditions. The majority of the infections are asymptomatic, showing no external signs of infection. These asymptomatic infections still cause damage to the lymphatic system and the kidneys and alter the body's immune system. Acute episodes of local inflammation involving skin, lymph nodes, and lymphatic vessels often accompany chronic lymphedema or elephantiasis. Some of these episodes are caused by the body's immune response to the parasites, most of the result of bacterial skin infection. However, where normal defenses have been partially lost to the underlying lymphatic damage. Large-scale treatment. Elimination of lymphatic filariasis is possible by stopping the spread of the infection. Large-scale treatment involves a single dose of 2 medicines given annually to the entire at-risk population in the following way. Albendazole, 400 milligrams, together with either ivermectin, 150 to 200 milligrams per kilogram, or diethylcarbamazine citrate, 6 milligrams per kilogram. These medicines have been limited effect on adult parasites, but effectively reduce the density of microfilariae in the bloodstream and prevent the spread of parasites to mosquitoes. This recommended large-scale treatment strategy is called preventive chemotherapy, when conducted annually for 4 to 6 years, and it can interrupt the transmission cycle. Vector control. Mosquito control is a supplemental strategy supported by the World Health Organization. It is used to reduce the transmission of lymphatic filariasis and other mosquito-borne infections.